Good afternoon, everybody. This is Matthew Wong, Professional Practice Specialist for Nursing and PSW on the Quality Best Practice Research and Education team, coming to speak to you a little bit about competency validation this year and how, as a result of a redesign in conjunction and collaboration with the nursing supervisors, the regional managers, recommendations from a research evidence, literature review, and in receiving the feedback from yourselves and your colleagues from previous years of competency validation that contributed towards a redesign of the overall process. This presentation will give you a brief overview of some of the changes that we'll be seeing this year and moving onward. So first, let's start with what's going to be the same. In terms of locations, practice sessions will be held at Lawrence or Whitby offices in the weeks leading up to competency validation, like always. Location-wise, for the Toronto Central and Central teams, competency validation this year will continue to be at George Brown College, the Sugar Beach campus, downtown Toronto, and this will be held once or twice per week across a few weeks with an additional day for a remedial if required. Similarly, for the Central East and Scarborough teams, this will be held at the VHA Whitby office and held over 4 to 5 days with 1 day remedial. In terms of timing of when this will be expected to occur, it will be like previous years in which the George Brown College site will have its competency validation in May to June, and the VHA Whitby office site will have competency validation sometime at the start or mid of November. So you'll ask yourself, what are some changes to expect this competency round? First, we'll compare it to what content is being tested at these stations. And so if you look at the previous competency validation cycle, depending on whether you were a child and family nurse, if you're doing shift and visiting, or if you were a RPN or RN or clinic nurse, you would do different skills stations. You would be tested on different things, which may include things like capillary blood glucose monitoring, central venous access devices, ambulatory pumps, catheterization, suctioning, tracheostomy, feeding pumps, injections, and so on. As well, if your supervisor identified that you need an additional skill to be tested as a result of your client load, then this would also be included within your set of stations. All in all, there were 10 or more stations that every nurse was expected to complete over the 4-hour time period. So we received some feedback from some nurses from previous competency validation years, and some of this feedback included a request that not all skill stations be tested for every single nurse, that some skill stations were derivative or repetitive of basic nursing practice. And this actually was reflected in literature in which the research evidence recommends that certain skills should be focused on for mandatory annual testing for all nurses. These skills that should be tested on include those that are high-risk skills, those that are informed by evidence-based practice changes like new best practice clinical guidelines, those skills that you really need to be focused on because there are quality improvement initiatives ongoing or notable incidents that have been reported that place client safety at risk, as well as those skills that organizations are contractually obligated to perform education and ensure that all their nurses are competent in, such as those part of the LHIN contracts, as well as accreditation standards. There were also recommendations to remove basic entry to practice nursing skills and those skills covered in nursing orientations, as this would be a repeat of skills already discussed. And last but not least, literature recommends removing those skills that are low frequency from the mandatory testing for every nurse. And this is actually in line with some comments made by nurses who noted that some skills were not seen frequently enough, or there were little opportunities to practice these skills in the field with clients due to the rarity. So what does this look like for this year's skill stations? Well, it means some skill stations will continue to be part of the annual competency validation, while others will no longer be included. So the skill stations that will remain as a permanent fixture include the central venous access device station, so specifically the one that deals with PICC lines, tunneled catheters, and ports, as it is deemed a high-risk skill if performed improperly, could introduce infection, line infection, sepsis, and other negative outcomes. Tracheostomy care and suctioning, as this is also potentially high risk if performed improperly. And last but not least, ambulatory pumps, as this is an accreditation requirement that every nurse be provided education and ensure that they can demonstrate competency for these pumps on an annual basis. Now, what are some of the skills that you won't see in this year's competency validation? Well, examples of basic nursing skills removed from annual competency include urinary catheterization, subcutaneous injection ports, and capillary blood glucose monitoring and insulin pens, as these are considered basic, as well as many, over the years, we noticed that nurses, for the most part, have no issues with these skills. And so, this will be further supported outside of annual competency through 3 annual drop-in skill fairs that we'll speak a little bit more on in this presentation. And you'll also see some removal of infrequent skills, such as the PICO, the Plurex MedQuest drainage systems, as well as compression wraps. And we will continue to support these through just-in-time training or group refresher sessions led by the clinical educators or nursing supervisors at team meetings or dedicated training days. In addition to the 3 permanent stations noted above, so CVAD, trach care suctioning, and IV pumps, 3 skill case-based stations will be annually identified by the nursing supervisors based on practice needs, changes in client populations and emerging trends, or incident reports in the previous quarters to inform and supplement the permanent set. So overall, there will be 6 stations in competency compared to the previous 10 or more stations. There will also be changes to format, as we have noted that there are multiple ways that people learn, as well as requests that skill stations are quite derivative in the way that they're repeated and can include a little bit more context to support learning and critical thinking. So the first component that will be added is a written multiple choice quiz component. This component in the first year, 2018, will be a 20-minute in-person paper quiz. And in the following subsequent years, we'll actually expand to a 4 or 5-minute interactive e-learning module with built-in interactive components like quizzes, completed at home at the convenience and leisure of the field staff. There will also be an introduction of more case-based scenarios reflective of practice and context within the skill stations that remain, so those 6 that were mentioned on the previous slide. Together, this comprises of a knowledge check in the form of a quiz component, as well as more contextual and an opportunity to demonstrate physical psychomotor skills. Last but not least, probably the biggest change to competency is the inclusion of a 4 to 5-minute team-based OSCE simulation scenario. OSCE stands for Objective Structured Clinical Examination. It's actually just a fancy way of saying role-play scenario. And in this scenario, the 3 nurses will work together, be provided a client case summary, as well as a plan of management, and be expected to work with the client or mannequin in this situation to provide care. And the clinical educators will be able to provide feedback in a debrief session following this 50-minute OSCE simulation scenario for each group that goes through it. What is important to note is that this is really an opportunity for group-based learning and sharing, as well as a critical thinking exercise. This is not a testing moment, as there is no way to fail the team-based OSCE simulation. It's really that chance to provide nurses to learn from each other to identify gaps in knowledge and learning, and for an opportunity to provide very complex or challenging scenarios to prepare nurses to face these in the field when they do occur. And last but not least, the last change includes the aforementioned skills days. So nurses had requested more opportunities for skills support year-round as opposed to just in the days leading up to annual competency validation. So the Quality Best Practice Research and Education team, so the clinical educators, professional practice specialists, and members of your nursing supervisory team decided that it'd be wonderful to facilitate 3 annual skill fairs where nurses are able to drop in to practice any skills they wish with the mannequins and support from the champions or educators. Additional benefits to the skills fairs include the opportunity for nurses to fulfill the CNO requirement and expectation for reflective practice. Through these skills days, nurses will be able to self-identify those skills they would like additional support in and seek out opportunities for practice. These may include skills that were originally included in competency validations of previous years. And the benefit of having those skills within a skills fair as opposed to in a skills competency validation process is that we won't be wasting valuable time testing experienced nurses on skills that they already are familiar with and can self-identify as not needing additional practice. Last but not least, it provides a judgment-free learning environment where nurses don't feel that pressure of being tested and more of an opportunity for them to refresh their skills and ask questions and gain some feedback in a low-risk learning environment. What does the new model for competency look like put together? Well, moving forward, the vision for the competency days include, or the whole process rather, includes 4 or 5 minutes of an online e-learning quiz component that will be completed at the leisure of the nurse at home, and an in-person component, which includes 3 4 to 5 minute sections, the first one being 3 15-minute stations that will change every year based on what nursing supervisors have noted as a clinical need or emerging trend. 3 15-minute stations that are permanent fixtures, and the 4 to 5 minute OSCE simulation scenario. Overall, this will be a total time of 3 hours, of which 2 hours and 15 minutes will be in person and 4 or 5 minutes at home, compared to a previous 4-hour in-person session. Outside of the actual competency day, there will also be those 3 days a year of supportive open skills days. Another way to visualize the changes is to look at the old competency day, in which it was essentially every 20 minutes, nurses will move amongst 10 stations with a rolling wave until they've completed all of their stations, to the new state, in which there will be nurses coming in groups of 3, moving amongst 3 permanent stations, each one being 15 minutes for a total of 45 minutes. Following this, all 3 nurses will move to the next set of 3 stations. Following this, they will move to the OSCE simulation where they will work together to have that experience with a complex or challenging scenario where they can work together. Once again, with the OSCE simulation experience, nurses are not tested. There is no way to fail, and this is really a learning opportunity to learn from each other, identify gaps in practice or knowledge, and to work together to find a solution to a complex problem. Overall, the changes will also allow for more nurses to be able to get through a particular competency day. So expectations for about 24 nurses to get through the 8 blocks of 45 minutes, and fewer champions and support staff will be needed to run the competency day. What this means for field staff is that compared to the previous 14 nurses per day, it means that more nurses will be able to get through their selected day, meaning fewer days of competency potentially, fewer requirements for coverage, as well as the odds are of a nurse getting their first choice for competency day is greater because there's more spaces for that particular day. Additionally, a shorter in-person competency day also contributes to it's easier to still see clients that day, either before or after competency. Over the coming 2 years, because this is piloting a new process, there will be a phased-in approach taken. In the first year, there will be no e-learning component, as VHA is still working on its digital learning strategy, and instead, the quiz component will be a paper session included within the OSCE station time. Moving from year 2, so 2019 onward, there will be a 45-minute e-learning module with quiz and interactive components to assess knowledge. In terms of skill stations, the 3 permanent stations and the 3 changing stations, for a total of 90 minutes, will be implemented this year in the 2018 competency validation process and continue moving onward. In terms of the OSCE station, because it is the first year of piloting a new process, there will only be one 50-minute OSCE scenario with a 10-minute group debrief afterwards, and the remainder of the 45-minute allotted time will be dedicated to a 20-minute written quiz in the place of the e-learning component that is not yet developed. In year 2, 2019 moving onward, there will actually be 2 OSCE scenarios, providing an opportunity to work together and solve complex problems for a total of 50 minutes. This year, 2018 competency will take about 2 hours and 30 minutes in person, and in 2019 onward, it will be 3 hours and 5 minutes, of which 2 hours and 45 minutes will be done in person, and the 45 minutes e-learning component will be done at home at the leisure and convenience of the nurse. Skills fairs. In 2018, there will be 2 skill fair days held, and in 2019, all 3 skill fair days will be held. It's important to note that as QBPRE and the nursing supervisors work to facilitate the new competency process, some work will be done, and in terms of ensuring that everything that is included in competency is not arbitrary, but rather based on clinical need and emerging trends, we will meet together to discuss what stations will be included in this year's annual Changing 3 Skill Stations, as well as one working meeting to create your OSCE scenario. What are the next steps? Well, please be on the lookout for any emails from the QBPRE team regarding when the skills days are planned, as well as when the competency station practice dates will be as we lead up to competency validation. We will also be alerting nurses to which 3 skill stations will be selected by your nursing supervisors to be added to the 3 permanent skill stations identified here. Last but not least, an email will be sent out with the final competency dates and venues and the instructions for signing up. Please feel free to contact your clinical supervisors as well as the QBPRE team if you have any additional questions regarding this process, and we look forward and are excited to be working with you to better meet your learning and education needs as it relates to maintaining annual competency and clinical practice. Thank you.